England's junior doctors started a second 24-hour walkout after last-ditch talks with the British government over pay collapsed. The government wants to introduce changes in the way junior doctors are currently being paid. The main sticking point is over weekend pay and whether Saturday should be classed as a normal working day. The last 24-hour strike was carried out last month. Junior doctors will only offer emergency care during this period like last time, and NHS England said that nearly 3,000 operations have been cancelled. They stressed, however, that many more have went ahead.
The worst thing we see in this contract is Jeremy Hunt's claiming that he can provide the same amount of services over 7 days that we're currently finding very difficult to provide in 5 without any extra funding or any extra doctors. So it's just simple maths. We don't see how we can spread what we currently do in 5 over 7 without adding to it, unless you want to take from what's currently been happening over the 5 days.
In a statement, the Department of Health said, "It is very disappointing that tens of thousands of patients and NHS staff have been inconvenienced by the BMA. We have now agreed the vast majority of the contract detail with the BMA, but it is a great shame they have broke the agreements we made at ACAS on the outstanding issue of Saturday working and pay for unsocial hours." Last-minute talks to end the dispute failed to provide a solution, with reports that the Health Secretary, John Hunt, personally vetoed one deal agreed by officials. According to a new Ipsos Moral poll, the British public overwhelmingly blame the government for the junior doctor strike that have been happening.
Well, now joining me to discuss today's strike is junior doctor Ben Bouquet. Ben, welcome to the programme. First of all, let me give you a chance to respond to that NHS England statement where they said that it's your fault that the doctors walked out of or turned down the agreement that was already on the table. What do you say to that?
Sure. Well, first of all, I'm not representing the BMA here. I'm representing myself, and I can speak on behalf of myself and on behalf of colleagues that I know well. For me, what's important here is that this dispute is not just about the content of the negotiations, but it's also about the context in which we're working and the strenuous working conditions in which many doctors are faced with on a daily basis. The NHS, as we know, is a world-class organisation, and it's worth defending. So if we look at it in terms of equity, it's available to all on a basis of need and not ability to pay. It's efficient, so in terms of the percentage of GDP that we spend on our healthcare system, it's around half of what the United States spends on its healthcare system for outcomes that are better than the United States in terms of life expectancy and in terms of healthy life expectancy. Now, what this contract and what this negotiation represents is it's part of a broader attack on this socialised form of healthcare. And I think that that's really important to stress, and that many doctors are finding issue with that and not just with the content of the negotiations.
But in your view, was it something that Jeremy Hunt did, which is one story that's going around, or is it something that the doctors decided not to accept that led to the necessity for a second day of strike action?
So the decision to take strike action, again, lay with the BMA and not with myself. I can only speak for the reasons that I and colleagues of mine are striking. And certainly a great deal of us really emphasise the importance of the context in which we're working. That doesn't go back to Jeremy Hunt at all. That goes back to the 1990s. So although this recent government has pledged what it claims is a record amount of funding to the NHS, over 5 years what we're going to see is a reduction in spending as a proportion of GDP. Now that, combined with the continual hemorrhage of funds that we're seeing in terms of the amount of funding that goes to servicing private debt by hospital trusts due to private debt taken out in the 1990s and later,
This is the PFI schemes.
This is the PFI schemes, and also the fact that we've seen a trebling of administrative costs with the introduction of an internal market. So that's a split between purchasers of healthcare and providers of healthcare. Means that we're seeing fewer funds reaching frontline services, and that's, we're feeling that at the moment. And junior doctors are raising issues about patient safety. We're seeing this on a daily basis. Junior doctors voicing their concerns about their ability to deliver safe care. And this is not being taken seriously by Jeremy Hunt, who continues to emphasise the importance of this contract and not the broader context in which we are working and the broader structural issues that the NHS is facing.
Well, let me just ask you a bit about that then. So, in your view, really, any increase in funding is either going to pay off interest on PFI hospitals or to wasteful management introduced by an internal market and not reaching frontline services. If that's the case, is that having an effect on the morale of not just the doctors, but of the entire NHS staff?
Absolutely, and we can say that this negotiation with doctors is not really just about a negotiation with doctors. A report from the Department of Health in 2014 made it clear that this was about a negotiation, or that they put in place plans to change the out of hours contracts that we have, both for doctors but also for broader healthcare staff who are on a different pay scale, on the Agenda for Change pay scale. So this is really just the forerunner of negotiations that will happen with the broader healthcare staff. And I think that junior doctors are feeling right now that this is becoming symbolic of a broader struggle within the NHS, both to retain our own terms and conditions, but also on behalf of our colleagues, our healthcare colleagues.
I see today that some student nurses walked out for an hour in solidarity over the question of the alteration of their bursaries. Is that right?
Yeah, and this is absolutely, indefensible in my opinion. To cut nursing bursaries when we are facing a deficit of staff in the NHS in terms of nursing staff, in terms of trained healthcare professionals, is completely indefensible. We need to be training people. We need to be increasing the numbers of trained staff. If you want some figures around this, when you look at the number of physicians that we have per head of the population in our country and compare that to some other European countries, for instance, Spain, here we have 2.8 physicians per 1,000 of the population. In Spain, it's 4.9. Now, we need to ask serious questions about supply of healthcare professionals. And a recent report, a recent article in The Guardian stated that Monitor and the NHS Trust Authority have issued instructions to NHS trusts to actually reduce their staff levels. Now, we know that that levels of staff are absolutely critical for patient safety. This is clear from the Mid-Staffs report. There are serious questions here around patient safety, and this is all being deflected onto this contract.
I mean, the government say at the heart of this is the whole question of a seven-day NHS. But I know that the junior doctors have said, well, look, we're working 7 days anyway on emergencies. Yeah. It's just elective surgery. I mean, all right. Perhaps in a perfect world, we'd all like to have elective surgery 7 days a week rather than 5 days a week. But what's the big rush to have non-emergency surgery over the weekend?
Sure. So there is an issue here, and there is evidence that has shown raised mortality rates over weekends. Although there is some dispute around those figures, it's important that we don't just dismiss them out of hand. If there are issues with patient safety at weekends, then a proper assessment of this and provisions need to be put in place, not deflecting this onto a single contract negotiation, and that's what the government has done.
Okay. One last question. Obviously, the NHS and its funding doesn't exist in a kind of sort of hermetically sealed bubble. Now, you're working in the field of public health. Do you think that when we're looking at these things, we should be looking at what else is happening in the society? If there's a growing gap between the rich and the poor, that will impact on the number of people coming through the doors of the hospitals. If health and safety at work is being cut back, then there's going to be more accidents and more people coming through the doors. Is that something that you see happening?
Yeah, absolutely. I mean, that's a really important point to bring out as well, that this shouldn't just be about the policies in terms of health care provision, but also in terms of wider public health. And that's not just in terms of the funding of public health services, which we know is being cut in real terms. So we're facing a £200 million cut this year. But also, as you've stated, in terms of the sort of regressive versus progressive nature of economic policy. So whether economic policy leads to a more equal society or a more unequal society is really important in terms of preventing health problems.
Okay, Ben Bouquet, thanks very much for coming and talking to us.